This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Imagine your body as a giant bustling city, and your organs, like your brain and heart, are factories that need constant deliveries of oxygen fuel to stay open. Normally, the air around us has just enough oxygen fuel to keep everything running perfectly. But when someone gets really sick or hurt, the delivery trucks break down and the factories start starving. Here is how paramedics fix that using emergency oxygen. 1. The mechanism of action. How it works. The air we breathe normally is only 21% oxygen, the rest is mostly nitrogen. When someone is in shock, has a lung disease, or is losing blood, that 21% isn't enough to keep their cells alive. When a medic gives a patient medical oxygen, they are turning that percentage way up. This creates a high concentration, pressure gradient. By filling the lungs with pure oxygen, it forces the fuel to cross over into the blood much faster, jumping onto red blood cells to be rushed out to the starving factories, starving organs. 2. The tools. How it's delivered. First responders choose a delivery tool based on how bad the patient is struggling to breathe. Nasal cannula. What it is? A clear plastic tube with 2 small prongs that sit inside the nostrils. When it's used, for patients who need a little bit of help but are otherwise breathing fine on their own. Flow rate. Set between 1 to 6 liters per minute. If you run at higher than 6 liters per minute, it shoots cold air straight up their nose and dries out their sinuses, which may hurt, and is useful in specific situations we will discuss in another video. Non-Rebreather Mask. What it is? A clear face mask with a plastic reservoir bag hanging off the bottom and one-way valves on the sides. How it works? The bag fills up with 100% pure oxygen. When the patient breathes in, they pull almost pure oxygen from the bag. When they exhale, the tiny plastic valves let their breath escape so they don't rebreathe their own carbon dioxide. When it's used, for serious emergencies where the patient is breathing on their own, but pale, sweaty, and desperately gasping for air, like a severe asthma attack or a heart attack. Flow rate. Set between 10 to 15 liters per minute. The trick is to ensure the flow is high enough that the reservoir bag stays inflated. Bag valve mask. What it is? A large, football-shaped bag attached to a clear face mask. When it's used, when a patient stops breathing or is breathing so slowly/shallowly that they are going to pass out. How it works? The rescuer holds the mask tightly over the patient's nose and mouth to create an airtight seal and physically squeezes the bag to force oxygen directly into their lungs. This is called positive pressure ventilation. Flow rate. Hooked up to 15 liters per minute of oxygen to deliver the maximum amount possible. 3. Assessment and titration. How much is right? Paramedics don't just guess. They use their eyes, ears, and technology. Too much pure oxygen can actually create chemical stress in the body called oxidative injury. Step 1. Assess the patient. To figure out if someone needs oxygen, medics use a mix of observation and technology. Look and listen. Are their lips blue or pale, cyanosis? Are they using their stomach muscles to drag air in? Can they speak in full sentences? Lungs should sound like a quiet, gentle breeze moving in and out. When someone is having a medical emergency, the sounds inside their chest change completely, telling the paramedic why they can't breathe. Pulse oximeter. A healthy person reads between 94% and 100%. If it drops below 94%, it's a red flag. Step 2. Titrate to effect. Paramedics practice something called titration. Think of it like adjusting the volume dial on a speaker. You don't want the music so quiet you can't hear it, but you don't want it blasting so loud it hurts your ears. Instead of leaving a mask on high blast, a medic will start with a device, watch the pulse oximeter, and adjust the oxygen flow. The goal is to get the patient's oxygen saturation back into a safe zone, usually 94% to 99%, using the least invasive device possible. If a patient is sitting at 95% on a nasal cannula, there is no reason to upgrade them to a suffocating face mask. If their numbers drop, or they look worse, the medic increases the flow or swaps to a stronger device. The golden rule: treat the patient, not the machine. If the pulse oximeter says 98% but the patient is gasping for air and panicking, you always listen to what the patient's body is telling you and give them the oxygen they need.